See, ovarian cancer to some extent is genetic. People having their first degree relatives with ovarian cancer or breast cancer, they are more susceptible or at risk to develop ovarian cancer. Then those people carrying BRCA1 and BRCA2 genes are also susceptible to develop this hereditary breast ovarian cancer syndrome. Apart from that, lifestyle has a huge role to play in ovarian cancer. Like patients who are most into fatty diet, processed food, lack of physical activities, obesity is one of the factor. So these are the risk factors. There is no pinpoint thing where we can see that this particular thing can cause cervical cancer. Is generally the lifestyle, and to some extent it is genetic also. But genetic factor is seen in those patients whose relatives or mother and sisters, they have cancers in early age, before 40 years. But if somebody has a cancer after the age of 40 or 50 years, then that is a age related factor. Then the risk of the next generation getting the cancer is equivalent to those who are not having any cancer in their family. Ovarian cancer most of the time is a very silent cancer. It is only diagnosed radiologically when somebody goes for ultrasound or an X-ray, or sometimes they are diagnosed with irregular menses, abnormal menstrual bleeding, or abdominal lump, bloating in the abdomen, irregular bowel habits. Later on, there can be pain in the legs, swelling in the legs, which are late symptoms. Ovarian cancer is also treated with surgery, chemotherapy, and radiation. The challenge is first to diagnose the ovarian cancer. Once we diagnose the case, then we have to do a surgery and we have to stage the cancer, and accordingly call is taken about the chemotherapy and radiations. If detected in early stages, definitely it has a good curative rate. And but if the cancer is in advanced stages, then chances of relapse may be there. But it all depends upon how the patient has been treated, whether he has taken the full dose of chemotherapy and radiation, and she has to be under regular follow-up. There should be a regular sonography done for all the females above 35-year age, so as to detect any kind of ovarian cyst or solid ovarian tumors, because most of the ovarian cancers are very silent and detected in very late stage. So if there is any suspicion of any tumor in the ovary, then we can do an MRI or a CT scan, and further we can plan for other blood investigations like CA-125. This is a very important marker of ovarian cancer which can detect cancer to a larger extent. The first thing is the lifestyle changes. Have a very good lifestyle, inculcate habit of having more fresh fruits and vegetables, less of fatty food and junk and processed food. Physical activity, minimum 45 minutes of physical activity is very important. Vitamin D is also very important for general activity of the body. And overall reduction of stress with yoga, meditation, or any kind of hobbies which can reduce the stress factor is very important. And overall a very good sleep is also very important, because nowadays people are not getting enough sleep. If sleep is not adequate, then obviously the stress hormones will be very high, leading rise to various kind of stress related disorder. So I will recommend that a good sleep along with a good diet and a healthy lifestyle will take us a long way and prevent any kind of lifestyle disorder as well as cancer.